We are live now.
Namaskar and a very good evening to all our viewers. I'm Bhavna Pandita and I welcome you all on our show, The Right Conversation. You all know that life is not same anymore. We are facing so many challenges on daily basis amid this COVID crisis. Even people who have recovered still face certain complications. Oftenly these days, we hear the news of losing one or the other life due to sudden cardiac arrest. And most of the cases so far have been the young and unexpected ones. So, to know the reason and more about heart related issues, we have today invited a specialist doctor who will apprise us with the valuable information related to the subject and will also advise us how to take care of our heart. We'll take up your queries and questions towards the end of the session. Please stay with us. Today, I have the honor to have here with me a renowned doctor and a great human being. Besides being a great cardiologist, he is a living example of a person with great heart too. He doesn't need my introduction, though I'll brief about him. Dr. Pawan Suri is Director Global Health Punjab and Chief Cardiologist in Global Hospital Jalandhar. Dr. Suri is an expert in the field of interventional cardiology and electrophysiology. Dr. Suri has so many felicitations, certifications, and specializations in his kitty. It will take me 2 hours to mention them if I go in detail. So I'll put it in short. He has done more than 20,000 procedures so far. He has been pioneer in introducing various new technologies in Punjab. Dr. Suri has been first in Punjab to perform conduction system pacing. He was the first in Jalandhar to use technique of retrograde angioplasty and shockwave lithotripsy in heavy calcified vessel. Dr. Suri is on editorial board of various leading newspapers and publications. He has received many excellence awards from MIDI and Best Cardiologist Award from Times of India. Welcome, Dr. Pavan Suri, to the show.
Thank you, Dr. Bhavna, for such a kind introduction, and thanks, Rohit and the Tiara News for giving me an opportunity to be part of this show. Thank you very much.
Thank you so much, Dr. Suri, for joining us today. Some of you might not be knowing that Dr. Pavan Suri was continuously giving free service and consultation to COVID patients during second wave. We are proud of such personalities who, besides being thorough professionals, never hesitate from delivering social responsibilities as well. Dr. Suri is the most compassionate and empathetic doctor, I must say. Community is proud of you, Dr. Suri. Let's get started. We all know that COVID has wreaked havoc across the globe. So want to know, how does COVID-19 affect heart? Of late, we have seen most people falling prey to heart attacks and cardiac arrest post-COVID.
Yeah, Bhavna, Bhavna, thank you very much for introducing me once again. And before I come to your question, I feel it privileged to be part of the team. In fact, you were the one of the pioneers of. You were the thinking tank behind that team, and you organized everything. And I must tell here the viewers that as a professional, it is our duty and responsibility to take care of the health of the patients. But at the same time, I feel that the non medical professionals who took an initiative during this COVID era need to be appreciated, and the I feel we all should be thankful for them. And I feel Mrs. Bhavna did a wonderful job, and she was applauded all over the globe for her contribution during the COVID times. And I feel that was a time when we interacted through that group, and hopefully in future also we will engage in such activities and work for the welfare of the patients. So coming to your question now, Mrs. Bhavna, yes, COVID our generation, as a Kashmiri Pandit or as a Kashmiri person, I feel that when we were thinking about 2 years back, we used to divide our life the pre-migration era and the post-migration era. But I feel our generation is the one which can claim also that we had a pre-migration era, we had the post-migration era, and then we also saw the pre-COVID era and the post-COVID era. The COVID, in fact, changed not only the health status of the people, but it also changed the mentality of the people. It actually made us think that we are not the superpower in the nature. There is somebody above us who is looking after us and who can take care of his nature the way he wants to. So we had some fallacies. We started thinking if one school of thought is to be taken care of, this is a man-generated catastrophe, a man-generated pandemic. If we go by that thought process, so I feel the God is above all of us, and this is a lesson, and this was a lesson for all of us to think in a more humane way and respect the Mother Earth. Regarding the COVID and the heart, initially when the COVID came, the more focus was on the lungs, because if we see to the receptors, the AC receptors, which this COVID attacks, so they are mostly found in the lungs. But there are other organs also where this receptor is found, and slowly and steadily over the time, 3 months or 4 months, we started feeling that it is not only including involving the lungs, but it also involving the heart. And most of the deaths in the world, if you see, about 1 out of 4 deaths, they are because of the cardiac ailments. And the COVID uh, is one of the viruses which affected the heart, and most of the deaths, if we can see, apart from the multi-organ involvement, the cardiac involvement was the major cause of the mortality in these patients. There were a number of ways, and it was a new virus. It was difficult for us to make the recommendation. And you can see, and if you follow the uh, you know the media, the guidelines routinely, every day, every 2 weeks, every 3 weeks, the things were changing, and we were finding one medication better. Another day, we were all refuting, no, it is not the medication to be given in such a group of the patients. So it was a new virus. We had to understand this, and now over the last 2 years, I feel we have understood it better. And there are various ways by which we can coming in the coming times we can discuss about the ways how it affected the heart. But most commonly, if you see, uh, the already comorbid patients who already had the heart ailment, they were the number one, patients or the people who were prone to have the mortalities because of the COVID infections. The reasons can be any, because of the exaggeration of the already existing disease, and some de novo deaths because of the COVID and the cardiac involvement were also seen. And they were the arrhythmic deaths because of the alteration in the heart rhythm and rate, because of the blockage, the pulmonary embolism, the clot formations, the myocarditis, the inflammation of the muscles, which we will be discussing in coming times. I feel you may have. So these were the number of ways by which the COVID involved the heart.
So my next question is, why do COVID-19 patients develop conditions like myocarditis and pericardial effusion? What is the reason behind that?
See, we have to understand. We have to understand what actually, every organ in the body is made safe in the nature. For example, if we talk of the brain, it is surrounded by the skull. If we talk of the kidneys, it is surrounded by the capsule, the renal capsule, what we call, separated from the surroundings. Similarly, the heart is surrounded by the layers, what we call the pericardium. And normally also there is some amount of fluid is present in that pericardial cavity, and that helps in contracting and relaxing the heart in a normal way. So what happens when the viral infection occurs? Viral infection occurs, it triggers the immune system in the body. And once the immune system is triggered, it causes the seroinfusion. Seroinfusion means that there is the leakage of the serous fluids from every cavity. It's not only the virus caused the pericardial diffusion. This virus caused the accumulation of the fluid in the whole body. We saw the patients having the edema all over the body. We saw the patients having this fluid in the abdominal cavity, what we call ascites in our medical terminology. So it is more of an immune reaction and the seroconversion reaction, wherein we found a lot of the serous fluids in the cavities. Similarly, this virus when gets stuck up, in the muscle of the heart, and it causes inflammation there. It induces an immune reaction there at the local process, at the focal points. There is an inflammation of the surrounding vessels. For example, in layman's language, I will tell you, if there is a cut on the body, the things start swelling up there. So similarly, what happens when the virus gets stuck up in the cardiac muscle, the surrounding muscle of the heart, it gets inflamed, it gets swollen, and that's what the myocarditis is, what we call the myocarditis, the inflammation of the heart muscles. So once the inflammation of the heart muscle occurs, there is the swelling of the heart, and it does not relax and contract properly. And there occurs the reduction in the ejection fraction, what we call the heart pumping in the normal layman's language. So once these things happen, the mortality is going to be higher. So these were the the morbid conditions where the patient accumulated the pericardial effusion, patient had the inflammation of the muscles, and this involved the long-term mortality and the short-term morbidity as well.
Dr. Suri, does medication given to COVID patients cause any effect on heart post-COVID?
Yeah, see, there if you go through over the last 2 years, there have been a lot of the recommendations of using one medication, then not using the other medications. In fact, there were some medications by which were in fact taken by everybody. In India, what the problem we have more doctors than what the number of doctors who are passed through the universities are less as compared to the doctors present in the family. So in India, we have a different scenario. We believe more on our reflexes. We believe more on our intuitions rather than on the scientific data. So similarly, what happened when the COVID came in, and there were recommendations of using various medications like azithromycin, the anti-allergics. So these are the medications actually. The chances of sudden cardiac arrest or the sudden deaths are more if the patient is takes azithromycin or the quinolones or macrolide antibiotics, and along with that it takes the anti-allergics. So these are some scenarios where I had one patient here who came with syncope, and he was our KP only, so residing in Jalandhar. He came in an OPD. He had one episode of syncope. He had taken azithromycin, and he had taken the anti-allergic as well along with that for 3 days, and he had one episode of syncope while he was having the lunch, or he was having a dinner, I feel. Yes. So yes, there are medications which were used or which were recommended for these group of the patients, the COVID patients, and definitely they have the side effects. I feel every medication has a side effect. There is a very uh, thin line between the medicine, between the drug, which is helpful as a medicine, and the venom. There is a very small difference. The only difference is the dose. If you use the small medication in a higher dose, it becomes a venom. If you use the higher dose of venom in a small dose, it becomes a medicine. So there's a very thin line, and that thin line is understood by the doctors or the professionals. But unfortunately, uh, in our setup, I feel this thin line is most of the times crossed by the chemists, by our elders, in our own families, also by our elders, by grandfathers, grandmothers. So they are all specialists in their own way. So that
So,
is what
in
that is
short,
how.
yeah, in short, we should never take any medicine without consulting a doctor.
Yeah, not only the COVID. I don't feel that.
Otherwise,
No, I just in the beginning of our conversation, I said that this COVID has been an eye opener for us. I feel any type of medication should not be taken by the person himself. Even a simple analgesics should not be taken. So I feel the consultation should be there. The medical consultation should be taken, and then then one should take the call.
thank you so much, Dr. Suri. On one hand, we say exercise and workout keeps us fit and healthy. But in some cases, we have seen most deaths happen in young who were very active and do gym or intensive workout, running, etc. What is the reason behind such deaths?
See that we have to understand the what we are recommending and what we are doing. That is very important. The perception is the personal, is a subjective understanding. What you perceive out of the recommendation is a personal understanding of the. So when we say that you have to do an exercise, and when we say that you have to remain physically active, that does not mean that you have to that does not mean that you have to cross your limits. Because when we talk about the exercises, we talk about the aerobic and the anaerobic exercises. So what we are recommending about the age of 40 years, at least if we are starting the exercise for the first time, we should have the cardiac checkup. We should have at least an echo and treadmill test to see our limitations, how much we can do. We cannot become the Salman Khan in one day. We cannot become the Sonu Sood in one day. It takes time, and it takes time, and it is the age also what matters. What we can do 20 years ago, we cannot do it today, and what we can do today, we cannot do it after 20 years. So everything that for a 20-year-old boy going to gym and doing the muscle training exercises, or more than the aerobic exercises, is acceptable. But at the age of 40, if you go and start doing the muscle building exercises without the prior cardiac checkups, the things are going to be worse. That is one part of it. The second part of it is that we are living in the world of glamour, and we get easily impressed by the people in the media, we get easily impressed by the celebrities. So we just want to be like them without knowing what we actually are, because everybody is unique, every human being is unique in understanding, in physical activity, in physical capacity. Everybody is unique. What I can do, the other person cannot do the same in the same if we make the same with the same yardsticks. So that understanding is very important as well. The third important thing I feel why the young people are getting the certain arrests or the certain cardiac involvements while doing the exercise, because we had an example. In fact, I had written an article also on that, on both the legends, on Kapil Dev when he suffered, because though he was not doing exercise at that point of time, but Saurav Ganguly was doing on the treadmill, was on the treadmill when he suffered an MI. So I wrote an article on that as well at that point of time. The younger generation, they are taking the powders or the protein powders, the when they are going for to the gym. I feel that is one of the reasons that one should take care of. There are no One should not take those the energy drinkers or the energy powders. They are the ones that cause the clot formation, and most of the people, while doing the exercises, if they overdose that, or if they overdo that, that is the problem, that they suffer from the certain cardiac arrests.
I have an observation here. I read somewhere that after intensive workout, our blood glucose shoots up and can remain like that for an hour or two. Does it have anything to do with sudden cardiac arrest, or maybe that they already have some underlying issues, and this further elevates the parameters without their knowledge and experience, and sudden cardiac arrest happens? What's your
See,
say on that?
yeah, see, blood sugar at that point of time, if it remains higher for the some amount of time, it is not going to affect the heart. Blood sugar only affects the heart when it is a prolonged and the persistently on the higher side, then it affects the heart. For a short burst, when you are doing the exercise, the blood glucose is going to rise, the heart rate is going to rise. We have to understand. We have to understand. In fact, everybody should, whosoever is interested in doing the physical exercise, especially, he has to understand the anaerobic threshold of his exercises. Anaerobic threshold, I cannot explain it here how we calculate it, but one should know his anaerobic threshold. And that, the other way of knowing how much exercise one can do is 220 minus the age. For example, if a person is 50 years of age, and his heart rate should not go beyond 170, so he should try, even if he's doing a treadmill, he is doing the aerobic activity, he is doing the cardiac activity, he is doing stretching exercises, so his heart rate should not go beyond 170. So that should be one of the limitations. If his heart rate goes beyond 170, he should stop it there, because you cannot make the heart to run beyond the limits. There is a limit to everything, so one should understand, especially in the people who are doing the exercise for the first time. What happens, their heart rate jumps more than what is normal. So they should understand that this way they can control the amount of the exercises. Once the acclimatization occurs, adaptation occurs to the exercises, they more or less, the heart rate gets adapted and it does not shoot to the higher levels. Then you can continue with the higher amount of the exercises. But definitely, when you start with the exercises, you should start it slow. Even if you are doing the cycling, even if you are doing the walking, Don't do the brisk walk on the very first day. Just walk normally, then start your speed after 1 week, and then start your more the duration also after 1 or 2 weeks. So the main idea of uh, advising the exercise, especially in the elderly group of patients more than 40 years of age. Why I'm calling the more than 40 years of age as an elderly? You may say that we are all elders now, but I feel because we are getting the MI, we are getting the heart attacks, we are getting the sudden cardiac arrest 10 years younger than our counterparts in the European and the American countries. For example, if the average limit of the average age of suffering an acute heart attack in Europe is 50 years, it is 40 years here. So we are 10 years, younger getting the heart attacks. That's why I have reduced the elderly from 65 to 55 in our group of the patients.
So the crux is excess of everything is bad, and moderation is the key. We should do exercises, but in moderation, keeping our
In
health.
moderation, there are recommendations for that. Recommendations are that you have to do it for 30 minutes uh, per day for 5 days a week.
Hmm.
If you are more interested, you can increase it to 30 to 45 minutes per day for 5 days a week. On an average, what is recommended is that 150 minutes in 1 week you can do. It is not necessary that you do exercise all the 7 days. You take the rest for 2 days. This is what is recommended as well. So one should not take it. One should not take it as a rule that I have to do exercise every day. You need relaxation as well. You need the time for the muscles to relax. You need the time for the heart muscles to relax, the skeletal muscles to relax. So 5 days a week, 30 minutes per day, do jogging, do cycling, do brisk walking, whatever you want to do, you can do, but don't exceed this limit.
Keep yourself fit, but don't put yourself, in
Yeah,
on risk.
keeping yourself fit is important, but you know this is what we have: the confidence and the overconfidence. Similarly, what we have here, the fit and the overfit. Don't overfit yourself. Just fit yourself as per your age. That's more important.
So, Dr. Suri, what precautions should we need to take post COVID to keep our heart safe?
See, I feel we need to take the same precautions. I just want to highlight here that this COVID came about 2 years back, and the number of deaths because of the COVID. I'm not saying that the mortalities were not there. We have seen the families suffering. We have seen the families, the heads of the families going and the kids coming onto the streets. And in weeks' time, the fate of the kids changed. We saw that, uh, those happenings as well. So I don't, encourage that. I don't say that the COVID didn't. Was normal or didn't do any harm to us. So I will be wrong if I say like that. But at the same time, what I want to enforce here that we have given so much of importance to the COVID, but if you see the number of deaths because of the cardiac ailment before COVID as well is higher as compared to what number of deaths we have due to the COVID. So we already are in an epidemic. We are the diabetic capital of the world. By 2030, we will be the diabetic capital of the world. We are already having an epidemic of the cardiovascular disease in the form of heart attacks, the heart failures. The younger population is getting involved. As I said, 10 years, our generation is getting the heart attacks at the 10 years younger than as our counterparts. So we are already running a non-communicable epidemic. We are already running in that scenario, and this COVID was a communicable epidemic. So this is the difference. That's so we got the everything came because it is an infective disorder. It spreads very quickly, so every attention was put on it. But if you see we are already in the epidemic of a non-communicable disease, and the way our younger generations, they are getting obese, and the young childhood, they are getting obese. So our generation, our future is going to be very much affected because of this epidemic. So we should consider this non-communicable disease as also a pandemic or as an epidemic. As we think about the COVID, we should also think about this. So post-COVID or pre-COVID, I don't feel there is much difference, but yes, definitely the COVID has taught most of the people to take care of their health, and I feel if by our this conversation we are able to motivate even 10 families to take care of their heart, I feel our job is done.
Surely. How often should we do a regular screening, or at what age people should do whole body checkups?
See, this is a very interesting question. I feel we have a lot of risk factors for the cardiac ailments, no, and as we have moved on, uh, the screening age has come down. So you can see the basic cause of heart attacks is the accumulation of the lipids in the coronary vessels. Coronary vessels are the vessels which supply blood to the heart. So the streaks, what we call the atherosclerotic streaks, they are formed at the age of 2 years. So if the Lipid Association of India says that we should start screening even at the age of 8 years, if there's a family history. Otherwise, if there is no family history of dyslipidemia or the abnormal cholesterol or abnormal lipids in the family, you should start screening at the age of 18 years. So I feel at once the child goes into the teenage group, we should at least have one screening of that child as far as the numbers is concerned. What numbers we should know? We should know the blood pressure of that child when he enters into the teenage, say about 17 or 18 years. The way we remember our age or our date of birth, each one of us should know our numbers. And what are numbers? And I feel the numbers we should know about the blood pressure. What is our blood pressure? That is the number. We should know our cholesterol levels, not only the total cholesterol, but all the parameters of the cholesterol, be it the triglycerides, be it the LDL, be it HDL, be it non-HDL. We should know our waist size. We should know our BMI. We should know our smoking status, yes or no. We should know our alcohol status, and we should know our diet status. So these are the numbers I feel which each one of us should know, in addition to what we used to know the number of age only. When we were kids, the only number what we used to know was our age. But I feel now is the time for every child to know the other numbers also, seeing the onset or the seeing the prevalence of the childhood obesity, seeing the prevalence of the young diabetics we are finding. So I feel these numbers should always be uh, screened and the person should remember. And once till the age of 40 years, from 18 to 40 years, every 5 years this number should be checked, and beyond the 40 years, every 3 years or 2 years the checkup should be done.
Thank you so much, Dr. Suri. As a layman, we always get confused between these medical terms, and often these things mislead us. Just want to know, what is the difference between heart attack and sudden cardiac arrest? Are they synonymous or altogether different terms used for heart related problems?
See, the medical people as medical professionals as well as the medical language, it is all confusing. It is all, you have the same disease, then you have four opinions by the four professionals. The problem is not with the medical professionals, problem is not with the medical language, the problem is with the literature. And medicine, if we talk about the medical sciences, it is one of the dynamic branches, and every day, every second day, the things change. For example, I will give you a simple example. Few years back, it used to be said that alcohol in moderation is good for the cardiac health, but I was never of that opinion, because as I said, the thin line is never kept thin unless until the line is very thick. You can simply cross that thin line, so it never used to be in moderation. And now, 2 days back, I was going through one of the journals. The American Heart Federation has said that alcohol in any amount is not good for health. So this is what the dynamicity is all about. And the people who do not update themselves, and the medical professionals who do not update themselves, so that creates the confusion. you know that is one of the reasons why the confusion occurs. So, coming to your question of cardiac arrest and the heart attack, we have to understand that heart attack is actually what we call in our terms the myocardial infarction or coronary artery disease or acute coronary syndrome. These are the different terms what we use for the heart attack. Heart attack is more of an acute process, and the patient presents with chest pain, patient presents with breathlessness, patient can have profuse sweating, and it is more of the problem with the blockage of the heart vessels. There is a blockage of the heart vessel. The blood does not go to the heart muscles, and deprived of oxygen, and patients will have chest pain, and then the patient will start having all the symptoms. On the other hand, the sudden cardiac arrest is a different problem. It is a problem with the electrical activity of the heart. If we talk about the heart as a whole has two functions. One is at what rate and what rhythm the heart is contracting. For example, if we say our heartbeat should remain between 70 to 100, anything below 50 is a bradycardia, anything above 100 is tachycardia. So that is one of the parameters of the heart that tells us that the heart is functioning normally. So one aspect of the heart that we have to understand is the rate and the rhythm, at what rate the heart is pumping. The other function of the heart is at what force the heart is pumping. So when there is a problem with the rate is more. For example, it goes to 200, the patient will have a certain cardiac arrest. So the cardiac arrest is more of the problem with the rhythm of the heart, with the rate of the heart, whereas the heart attack is the problem with the blockage of the heart. So these are the two different terms. Though in 80% of the patients who have a certain cardiac arrest, the cause remains the blockage of the heart, because once there is a blockage of the heart, the first hour is the very crucial hour. Once the patient starts having chest pain because of the heart attack, the first hour is very crucial, and most of the deaths that occur because of the sudden cardiac arrest in that 1 hour, and that is why we call that 1 hour as the golden hour. If we are able to survive, if we are able to make that patient survive the first hour, the chances of death of that patient comes down. So first hour is very crucial. So sudden cardiac arrest is a problem with the cardiac rhythm and rate of the heart, and the heart attack is a problem with the circulation, with the blockage of the heart. So these are the two different things.
If we talk about cardiac arrest, what are the symptoms of sudden cardiac arrest? Does it have any warning signs?
See, sudden cardiac arrest, this is an unfortunate thing, and at times the only symptom or only the presentation of the sudden cardiac arrest is the death. So this can be the first symptom. Patient may have nothing. You may see the patient have come from the person has come from an office or from the outside. He has had his dinner, went to his room, and the family were not able to get him up in the morning. So this can be the only presentation. The sudden cardiac arrest, the issue with the sudden cardiac arrest is that in most of the times you don't have any symptoms, and patient the first symptom that the patient can have is the death only. But yes, there are certain situations. For example, if we talk about the young patients, we have various channelopathies, various disorders of the the receptors of the heart. We have various conditions, or we can have the patients having an angina. Angina is a chest pain. The patient has the chest pain. As I said, that the commonest cause of the sudden cardiac arrest is the heart attack, is the coronary artery disease. So this can be the first presentation. Patient can have the chest pain ongoing for a long time, and he is ignoring that thing, and the patient can have a sudden cardiac arrest because the patient shifted from the angina to the acute heart attack. So there are warning signs, mostly in the form of chest pain, the sweating, the breathlessness on anything that happens on the exertion. One thing the people should understand, that most of the times they feel that there is some problem with there is some gastric problem, or he's not able to pass the gas, or he's not able to pass something is there in the chest, and he misdiagnoses with the chole bhature what he has taken. He misunderstands it with something what he has taken in about an hour or two back. But practically speaking, I feel anything that happens on exertion and which does not get relieved in 30 minutes is an heart attack. So he should not waste time. I'll give a simple example. I was in the hospital, and it was uh, 2020 match between India and West Indies, I feel, and it was Sunday at that day. I just came for the rounds on that day, and I saw one of my colleagues. He was a resident in gastroenterology surgery, a very good guy. And I saw him in the corridor, and I said, "Yeah, what are you doing here? Go and watch the match." And he said, surgery करनी है. मैं कहा, don't take so much stress on Sundays. Go, and if it is an emergency, then it's fine. If it is not, then you can do it on Monday. He said, नहीं, I want to do it. Okay, sir. मैं कहा, go ahead. And you will not believe, in the night at 12 o'clock, I got a call from an emergency that this doctor has come, and he's we are not able to revive this patient. I saw came rushed in, and I was not able to feel his pulse and everything, and he was already dead. The reason being that he was watching. Then I talked to his wife. He had a 2-year daughter. I talked to his wife, and she said that after he had his dinner, he came up to his bedroom, and he was not feeling comfortable. He took three bottles of mucin gel or digen gel, what we call, and he was not getting relieved. And then suddenly he was having sweating, and he did not consult the doctor. So you can see the level of negligence, even if by a medical professional, to such an extent that that costed his life. You can understand the level of negligence what we can have in the person who does not have the medical knowledge. So this is what we should try to create. The awareness programs should be there to make people aware. Yes, I feel it is easy to say than to believe on it, because there is lot of cost involved, lot of movement involved, then the lot of faith, which is more or less nowadays. But now that that is a part of it. But one has to take care of his health in the way in a professional way, and should I feel more importantly should take care rather than neglect his health.
So why do cardiac arrest happen in sleep? You said it's due to stress or negligence.
No. Cardiac arrest happens because if there is some problem in the heart, and you are not able to come to the treating physician, or the treating physician is not able to diagnose it, and you are wasting the time, because what we call in our language, the time is muscle and muscle is life. So if for example, the patient of an acute heart attack, there is a blockage of the vessel. Unless until you don't open that vessel, as early as you open, you are giving the better life to the patient. The more time you waste, the more chance of certain arrests are there, the short term as well as the long term. So the main crux comes to the treatment part of it. So the as early as you are able to give the treatment to the patient, the long term and the short term mortality is going to be less.
Is cardiac arrest preventable by any means?
Yeah, yes. Cardiac. We have medications nowadays. There's no doubt about it. And one thing, what in the last 2 years, we have got very good medications have come up, which are helpful in preventing the sudden cardiac arrest. And I tell you, we have seen the patients coming out of the sudden cardiac arrest, and uh, put them on the treatment. If they needed the stenting, we did the stenting. If they needed the bypass surgery, we did the bypass surgeries, and patients are doing well. We have n number of patients who have suffered a sudden cardiac arrest, and survived. What we call them the survivors of sudden cardiac death. This is the term what we use. The SCD is a sudden cardiac death, and SCA is a sudden cardiac arrest. So once we are able to save those patients, the sudden cardiac arrest patients, we call them survivors of sudden cardiac arrest. And we have a series of patients where we have saved those lives, and they are doing well.
Can it happen at any age, or is it age
Yes,
related?
yeah, it can happen at any age, but as I talked about, as you grow, as the age advances, the coronary artery disease, the heart attacks is the commonest cause. About 80% of the patients will have the sudden cardiac arrest because of the heart attacks. So that thing should be kept in consideration. In young kids, yes, we have the family history. In fact, what we call the SIDS, sudden infant death syndrome, this is also used to be considered as one of the reason causes of sudden cardiac arrest. What used to happen in this SIDS, the sudden infant death syndrome, the infant lies by the side of the mother, and mother during sleep used to roll over that baby, and in the morning the baby would be asphyxiated, and he would not be there. So they called it as a sudden infant death syndrome. But slowly they realized that it was not related with the cardiac condition, but it was related with some other condition. So definitely there are some conditions in the heart where as you said, the medical terminology is confusing. We have the long QT syndrome, the short QT syndromes. We have the channelopathies, which happen in the young people, and they have the family history. And if there is a family history of the sudden cardiac arrest, if there's a family history, you should always evaluate. You should do the genetic mapping of those patients, the genetic study of those siblings. And we have a few families where we have done the genetic study, and we have put the AICDs. The patient is a sudden suffers from the sudden cardiac arrest, and we are able to find that this patient will have a recurrence of this sudden cardiac arrest, we put the defibrillators in them. You might have seen in the movies also, in one of the movies of the Akshay Kumar's, where he was giving the shock, the external shock to the patients from outside. So we have the devices what we insert into the heart, and they give the shock from the inside within the heart, and they save the lives of the patients. So we have the modalities for the treatment as well. And yes, young people can also have, if they have a strong family history, if they have some congenital these things, channelopathies, uh, and in elderly, yes, coronary artery disease. Even in the cardiomyopathies, we'll be discussing. I feel we'll be discussing about those as well. That can also have the sudden cardiac arrest.
थैंक यू सो मच डॉक्टर सूरी फॉर योर डिटेल्ड एक्सप्लेनेशन. हम व्यूअर्स के भी क्वेश्चंस लेंगे, बट अभी थोड़ा रुक के. अब अगर हम बात करेंगे हार्ट अटैक्स की, तो मेन कॉज इज आई थिंक कोरोनरी हार्ट डिजीज. Would like
Yeah.
to know more about coronary heart disease. What is it?
See, coronary artery disease, the coronary arteries are the vessels which supply the blood to the heart. As we have the carotid arteries that supply the blood to the brain, we have the renal arteries that supply blood to the kidneys, we have the splanchnic arteries that supply blood to the gut. So similarly, we have the the coronary arteries that supply blood to the heart. And as I said, that at the age of 2 years, the streaks are being formed. In fact, the seeds are laid. Seeds for an atherosclerotic process is laid down during infancy, and at 2 years, these streaks are formed. Now, it all depends upon your genetic setup, and your family history, and your lifestyle. These are the three things. If they are in your favor, that there is no genetic history, there is no family history, and your lifestyle is very good, so you are unlikely to get the coronary artery disease. But if all the three are bad, you have a strong family history, the genetic is not even in your favor. The only thing what is in our favor is the lifestyle modifications. You cannot change the genetics, you cannot change the family history. So even if these two are not in your favor, and you are able to control your lifestyle, if you modify your lifestyle as per the need of an hour, then definitely the chance of the coronary artery disease is going to be less. And this is what we believe, that prevention is better than cure, and the prevention is possible only when we are able to modify our lifestyle rather than going into that.
So आपने कहा कि coronary heart disease का जो main cause है, that is family history and our lifestyle. So we should, if we don't have family history, we can, adjust our lifestyle to that level.
Yeah, for your happiness and for the happiness of the viewers, the women are protected from the heart attacks up till the age of 45, 45, 50, till they get the menopause, and after menopause they are equally prone to have the heart attacks. So I feel that should also be taken into consideration, the women health.
I'll come to that question also.
Okay, okay, you have another question about the women separately. So, so you have a question on the women separately. No issues, no issues.
Yes, yes. Can coronary heart disease be cured?
See, what we talk about, I always tell to my patients, we can never match the nature. Whatever we do, we can never match the nature. So how God has made us, even if we do the plastic surgery to any extent, we cannot. Nobody can replicate me as a in any other person, and I know. So similarly, whatever we do, we can never get to the normal. So cure, I don't feel the term cure in medical terminology should be there. Yes, there are certain things like, you can have the gallbladder stone, it's causing the problem, that is fine. You do the surgery, take out the gallbladder, then the patient is cured of the disease. But actually, that is not the disease. What we are talking about when we are talking of the disease can never be cured. So that is from the cardiac point of view. So whatever we can do, we can only potentiate or help in prolonging the life. We cannot prevent deaths. The deaths we cannot prevent. The one, even Bhagwan Ram has come, he had to go. Lord Krishna had come, he had to go. So anybody mortal on this earth has to go. So we cannot prevent. We cannot. If we were so powerful to cure the person of the disease, nobody would die. So I don't feel the cure is the accurate term what we should be using. But definitely, yes, we can prolong the life. About 30, 40 years back, The average lifespan was about 55, now to 65, and in coming times maybe it may be more. But actually, the term the cure is not the appropriate term, but we can prolong the life with medications, with therapies, with newer interventions. Definitely, the lifespan has increased.
Who are more prone to heart attacks?
Who are more prone to heart attacks? The people who have a genetic susceptibility, who have a strong family history, who smoke, who take alcohol, who do not exercise, who are physically, who love the sedentary lifestyle, who do not control their diet, who do not know their waist circumference, who do not know their BMI, who do not know the number of their lipid contents, who take more of the sugars, who take more of the salt, who I feel these are the people who are more prone to have the coronary artery disease, irrespective of the gender. I'm telling you now.
Yes, it was a notion that the women are less prone to heart attacks, which has now changed. What all do women need to know about how women can experience heart attack differently from men? Do
See,
we
I
have
feel,
any different symptoms than
yeah,
men?
please. Do
Do
they
they
have?
have different symptoms?
Yeah.
If
See,
they
I
have heart
feel
attack, do they have different symptoms?
if you talk of any of the, you know, be it the human, be it the any other race, any race, any the women are the most powerful species in any races. So they are the most powerful, not in the sense that they can fight on any issues, but they are powerful emotionally. They are powerful, genetically also they are powerful. They can absorb more stress as compared to the men. It is not my saying. It is the saying of the literature. What I'm telling you, the women at the same time, at the same time, the women are the most sufferers because of the patriarchal society. The problem with the issue, the problem with the society is that the we in our day-to-day practice also we find the less of the women they can volunteer themselves for the regular checkups. We find the males more dominating, coming and I want this checkup, I want this checkup. Once the female starts talking, they say no, it is nothing like that. ये तो ऐसे ही चल रहा है. So that thing should be taken out of our minds. The women are equally prone; they are equal partners in the society, and that system, I feel my personal understanding is that they should be equally. If there should be nothing like that, the woman is superior than men or the man is superior than the woman. They are all equal, and they should be kept on the equal standards. But the nature also has played a role in differentiating the men from the women. And if we talk about the heart attacks, the symptom presentations of the woman is different as compared to the man. The men usually present with the chest pain, they usually present with sweating, but females, the women folk usually present with atypical symptoms. And it is very difficult at times to pick up their symptoms, either because they are not able to present it in that way or the presentation is like that. So the symptomatology is also different. The perception of the disease is also different, and the version of the symptoms is also different in the females as compared to the men.
Thank you. So, ladies, go and get yourself checked. You are very important. Don't think heart attacks happen in men only. What is the first thing
They
one
can,
can do?
they can, Bhavna, they can clear the heart attacks in the youth times, but in the after the youth is over, I feel they should also take care of their hearts.
Yes.
On the
What
lighter
is the
note is,
first thing? What is the first thing one can do if he or she experience any symptoms like shortness of breath, chest pain, till he or she reaches out for medical help? How can an immediate family member or the person he is with help that person?
see the the human psychology depends believes on the negligence. Human psychology is always negative unless and until proves otherwise. I will give a simple example. You know, if as a kid we used to travel in the train or in the bus, our elders used to tell us if somebody offers something, don't take it because something उसमें कुछ मिला होगा. So this is all how it gets inbuilt in our psychology in our brains. Okay, so when a patient first suffers or feels some discomfort in the chest, the first thing that comes in his mind, oh, it can't be heart attack because I am all right, I am nothing, I am doing nothing, I have nothing to do with the heart attacks, I am totally healthy. So this is the first wrong step what the person takes. The first step what the person should take, not only in the health, not only in the heart health, but in the life also, is to accept the fact. One should live with the reality that this fact is there and I have to accept it. It may not be in his favor, it may not in her favor, but one has to accept the reality, the fact. So similarly, when a person suffers any sort of discomfort in the chest, the first thing that comes is that he will go to the chemist and he will take some Pantocid, Aciloc, he will take some Digene gel and then start trying to burping it out and then think as I'm feeling better. When after 2 hours or half an hour again, he will again have the same symptoms and then he will again repeat the same thing till he will create the catastrophe for himself. The first thing what I suggest or advise is to accept the fact that this thing can happen to anybody, and age is no bar now, as I have already discussed in a few minutes back, that we are getting younger people. The youngest patient what I have done, in which I have done the stenting as a primary angioplasty, what we call, is 21 years, and he was on a birthday party. He had gone to his friend's birthday, had some liquor or enjoyed, and he had some dance ones there. And suddenly he had a chest pain, and you will be surprised that his father came along, and he said, how is it possible? How can he suffer from an heart attack when I am alive? So it was difficult situation for us also to make him understand, but fortunately he understood, and then we were able to. And he is on a regular follow for the last 10 years with me. So this is the youngest patient I have done. So once the person suffers the uh, any sort of chest discomfort from the umbilicus to the lower jaw, we have seen the people going to the dentist and then the tooth is being extracted and there has been sudden deaths on the table only. So any pain or any discomfort in the chest from the lower jaw to the umbilicus, one should think about the cardiac pain. It is not necessary that the patient has a pain in the left side and then only it is cardiac. So any pain from the umbilicus to the lower jaw is a cardiac pain, number one. Number two, any pain or any discomfort in that, it is not actually the pain. It is actually a sort of, you can say, a pressure, a sort of discomfort in the chest. He wants to get it out, but it is not getting out. Choking side of sensation. Along with that, if he gets the sweating, if there is a sweating associated with it, the chances of having a heart attack is more than 90%. So any chest discomfort with sweating, the chances of heart attack is more than 90%. Any syncope or any abnormality with the breathing, they are an associated factors. Usually in females, the chest pain is atypical, but they can present with the breathlessness, what I already talked about. They have a little bit different symptoms as compared to the man. So acceptance is the first thing they should agree, come on to the board of, regarding that. The second thing is, even if it is not the heart attack, there is no harm. First of all, you should loosen your clothes, loosen your buttons if they are tightly, make the free fresh air to come in, and then there is no harm in keeping the desprin at your home. Desprin, not the normal desprin, the disposable desprin, 325 milligrams, and that is not to be dissolved in the water, that is to be chewed, because once you chew it, it bypasses the sublingual it bypasses the hepatic system and it gets directly involved, directly absorbed in the blood, and it can help in the clot dissolvement. And you can be surprised the efficacy of using the disposable discipline or chewing the disposable discipline 325 milligrams. You can save 1 out of 4 lives. 25% of the people can be saved by just this act. So if
Given.
4 people suffer an heart attack and they take the discipline 325 milligram, chew it there, the chances of saving one person out of the four is there. The third thing is, you should contact the doctor rather than going to the chemist. You should contact the whosoever is available and get an ECG done. So these are the things. There are people who take the sorbitrate sublingually. That is nothing to do with the mortality. That is not going to affect the mortality. That is only going to relieve your pain. But unfortunately, if you take it more than two, the blood pressure will come down. Then it will create problems. So Sorbitrate, the common used medicine, what we use under the tongue, it should be avoided because it is not going to give you the benefit. The only thing what is going to give you the benefit is the Disprin 325 milligrams, that to be chewed. And if you are from a medical background, you can take the statins 80 milligrams also at that point of time, and then move to the hospital as early as possible.
If the patient is feeling choked, do you advise any CPR to be given to the patient?
See,
If,
yeah,
if his condition is deteriorating, yeah, till the time we take him to hospital or doctor.
see, CPR is a cardiopulmonary resuscitation, and it is only uh, advised to do the CPR when the person suffers a sudden arrest. That means the patient is having the chest pain and the person collapses. And if collapse does not mean the patient is lying down and he is not able to get up, the collapse means that patient is not able to breathe. And you are seeing that patient is not responding, you should start the CPR there and then only. Then you should not wait. Because the time duration, if you lose 10 minutes of CPR, if there's a delay of CPR by 10 minutes, the brain will get damaged. We may be able, we have seen the patients where patients have come, they have done the CPR in the ambulances also, they have reached our emergencies, we have revived the heart, we have put the TPI, temporary pacemakers, we have revived the heart, but unfortunately the brain could not be revived. There was a young female, 38-year-old female, she came to us, she had an arrest in about 1 kilometer, she had an MI and she was in an ambulance and she had arrest on the way. The associated doctor, he did the CPR all the way, uh, reached to the hospital. We revived the heart, but we were not able to revive the brain, and we had to declare or send the patient home after 3 days because the hypoxic injury to the brain was already done. So if you delay the CPR by even 3 minutes or 4 minutes or 5 minutes, the damage to the brain is done. So and then we nobody can help. So CPR is the needs
It
to
is
be done only.
given within first 1 or 2 minutes.
Yeah, I'm not getting you. You are
Uh,
asking me
if
something?
yeah, if CPR has to be given to a patient, it has to be given within 2-3 minutes. You are saying.
Not within 2 3 minutes. It should be started there and then only. Don't wait for 2 minutes. And there is, I feel everybody should be aware about the CPR. Even the husband, the wife, the kids, they all should be aware. I feel there should be programs all over in the schools. There should be the program in the bank officials. There should be the program of the CPR. We have taken some initiatives here. We are doing the CPRs and the programs also. So everybody, each one of us should know how the CPR is done, and that even if
Very
even if a single life or two lives are saved because of the CPR by the non-medical professional at the home, I feel the nothing can be better than that.
when we talk about heart, different terms come to our mind like lipids, cholesterol, triglycerides. Can we know their role and how to manage them to keep our heart healthy?
I feel for the last 1 hour we are talking about heart only. So I feel we are talking about heart only. Yes, I feel what you are asking about is the risk factors.
Yeah,
So I talked about there are, if we go to the literature, there are about 200 and 200 plus risk factors for the heart. But the most conventional risk factors what we follow and what which have more impact on the coronary artery disease or the cardiac health are 9 or 10. And 9 or 10 is your age, your gender, your diet, your smoking, alcohol, blood pressure, lipids. Uh, if I'm missing something, your sedentary lifestyle, your waist size, and body mass index. So these are the 10 risk factors which one should always keep in mind, and every yearly he should or she should check up these parameters. And one thing I want to stress here is most of the times we see that patient calls us and he says my cholesterol is 220. So this total cholesterol has lost its meaning nowadays. So it is all the lipid components which are important. So once you are doing the lipids, so don't believe on the total cholesterol only. It can be 220, but your other parameters may be normal, so nothing to worry about. Uh, On the other hand, the total cholesterol can be 170. but the parameters, the LDL, the SDL, the triglycerides, the non-SDL, the VLDL components, they may altogether be not in your favor. So you may have to start with the medications. So when we are talking about the lipids, we have to talk about the lipid profile, or what we call the lipid panel. You have to do that and then see which lipid is on the higher side, which lipid is on the lower side, how much are the triglycerides, and then how much is the non-HDL, and then decide what is to be taken, whether the physical activity is to be strengthened, whether the diet restrictions is to be strengthened, or the medications is to be taken care of. So it all depends upon the lipid parameters rather than the single parameter of the cholesterol.
What is the role of anticoagulants and diuretics in heart patients? We have seen most of the elderly or most of the patients are on diuretics.
Okay. See, diuretics are the medications which are used as an antihypertensives. Like if the patient has a high blood pressure, we can use the diuretics. Diuretics are used in patients who have heart failure. The diuretics are used in patients who have chronic kidney disease with fluid retention. Diuretics are used in patients who have cirrhosis of the liver, where there is, the fluid retention. So diuretic is actually a medication wherein you lose lot more of the water from the body. If there is retaining of the water in the body, more of the water is to be lost. So there are some conditions, there are certain conditions where the diuretics are used. The heart failure, the blood pressure, as I already discussed, few of these scenarios. Regarding the anticoagulation, I feel the anticoagulation got the boom because of the COVID also, because COVID in last year or two has been considered as one of the procoagulant. It creates a procoagulant state. Procoagulant state means that it makes the person predisposed or to the clot formation. So anticoagulation, we have seen the patients of COVID who have recovered nicely and then shifted to the ward, and suddenly on one fine morning we find that the sudden death is there. So the findings of the pulmonary embolism were there, that the clot formations were more, and once the clot is formed, it can either get stuck up in the heart or it can get stuck up in the lungs. If it gets stuck up in the lungs, the patient, we call it pulmonary embolism. If it gets stuck up in the coronary vessels, the heart vessel, we call it as a heart attack. So both are dangerous. So both can take their lives. So we have seen the role of the anticoagulation in the post-COVID era, and in patients who have the valve surgeries done, patients who have the the more prone to have the deep vein thrombosis in the thrombus formation in the legs. So these are the people where the anticoagulation has a role, or the anticoagulant should be put in.
Thank you so much for your detailed explanation on heart attack and cardiac arrest. Now let's come to another topic: heart failure.
There is
What's
one more
heart?
topic. Okay,
Yeah.
okay, okay.
What's heart failure, and what are the different stages of heart failure?
See, heart failure is, as I said in the beginning, that the one of the functions of the heart is to the main function of the heart is to give blood to the whole body, and one of the ways of giving the blood to the whole body is the force with which the heart contracts. So heart failure is actually the disease of the muscle. So once the heart starts, and once the heart does not contract properly, it is not able to give blood to the organs properly. The adequate amount of blood what is needed in the other organs is not given. So the patient develops the symptoms of the heart failure. The another aspect of the heart failure is when the heart is not able to relax properly. When you have to give something, you have to absorb that first and then you can give it. When you have 100 rupees, then only you can give 80 rupees. So for 100 rupees, you have to open the heart. So at times, the person's heart is not able to receive that 100 rupees. So once it does not receive that 100, the only thing what it can give only 20 ml or 20 rupees out of his own pocket. So the problem with the relaxation as well as the contraction of the heart. So once this is a relaxation of the problem with the relaxation of the heart, it is not able to relax properly and absorb the whole blood. We call it the heart failure with preserved ejection fraction. Once the person absorbs everything, it accommodates more, but it's not able to pump out everything, most of it. So we call it the heart failure with the reduced ejection fraction. Both are not good. But as far as the mortality is concerned, as far as the long-term morbidity is concerned, the heart failure with reduced ejection fraction, where the pumping capacity of the heart is very low, is more dangerous as compared to the heart failure with preserved ejection fraction. So that
How
is,
long?
yeah.
Okay, please
You had another
continue.
question about the heart failure. Yes, I just
Please
forgot.
continue.
You had another question about the heart failure. Yeah, stages of heart failure. You were asking. Yes.
Yeah.
So when we talk about the stages of the heart failure, we have to divide it the heart failure into the stages and the class. Class means we divide the heart failure on the basis of the New York Heart Association (NYHA). That is the class of the heart failure. The class 1, class 2, class 3, class 4. Class 4 is that the patient is having the symptoms of heart failure in the form of breathlessness, the dyspnea, uh, not able to work even at the rest. So if the patient is having a breathlessness or heart failure symptoms on rest, then it is an NYHA class 4. And similarly, if the patient is having on the same symptoms on more exertion what he normally does, then we'll call it NYHA class 1, and in between are the two. As far as the stage is concerned, we have the stage A, B, C, and D. Stage A is the person has a risk factor. For example, a patient is having hypertension and diabetes and dyslipidemia, so he becomes a stage A heart failure. We do an echo is normal. So everything is normal, but only he has the risk factors. So that becomes a stage A heart failure. This is very important. Most of the times we say nahi khali blood pressure hai, koi baat nahi hai, nothing to worry about. But this categorizes once the patient develops the heart hypertension with normal cardiac function with no symptoms, it becomes a stage A heart failure. Stage B heart failure is he comes to us, we do a regular checkup. Patient says, I have nothing. We do the regular checkup. We find the patient is hypertensive. He has a high blood pressure. He has high cholesterol. And at the same time, we do an echocardiography and we see that ejection fraction is less. His heart pumping is less. So it becomes a stage B heart failure, meaning thereby there is a structural heart disease with the risk factors, but the patient is having no symptoms. The stage C comes when the patient comes to us with breathlessness and we do an echo, the heart pumping is less. So now he has the risk factors, now he has the structural heart disease, his ejection fraction is low, his heart pumping is low. At the same time, he is symptomatic, he becomes stage C. And stage D is when he is having full fledged heart failure. So these are the different stages of the heart failure. So stage A, only risk factors, stage B, risk factors with abnormality in the heart pumping, stage C, risk factors, abnormality in the heart pumping, and the symptoms, and stage 4 is full fledged heart failure.
Can one recover from heart failure?
Yes, surely, why not?
And how long can one live with heart failure?
See, we have to understand the first of all the cause of the heart failure. As in the beginning of our talk, when we discussed or talked about the myocarditis, so this is one of the causes of the heart failure. Myocarditis is the inflammation of the muscle, as we discussed, and the patient can present with the heart failure. And the myocarditis, when we follow these patients, it follows the rule of 33. That means that 33% of the patients they will recover normally, 33% will have the same status, and 33% will deteriorate further. So this is what the natural history of the myocarditis is like. So if a person suffers, so we have to understand the cause of the heart failure. So if a person has a myocarditis, there are 33% chances or 35% chances that the patient will come to the normal. Similarly, for example, if a female delivers a baby and she develops symptoms within 6 weeks or 6 months of after the delivery, and we do an echo and we find that there is an heart pumping is less, so what we call the postpartum cardiomyopathy, this also comes in the heart failure, but this is recoverable. So this patient recovers from the heart failure. This is a reversible cause of the heart failure. The only thing is that we advise that lady that she should not plan for the baby again, because otherwise the heart is going to get affected again. So there are conditions that similarly, for example, the patient comes to us with an acute heart attack and a lot of the muscle damage is done. We do an angiogram, we find that there is a blockage of the vessel, the 100% blockage of the vessel. We put the stent, put the patient on the medications. After 6 months, the patient's heart pumping recovers. If his heart muscle is not dead, it is only ischemic. So there are conditions where the heart failure is reversible. But yes, most of the times, if the patient does not recover or the heart failure does not recover, but we have the medications. And as I said, in the last 2 years, especially in the field of heart failure, we have got two, three medicines, two, three groups of medicines more, which are found to be very, very effective, and they can live a normal life.
So, as I got it, that heart failure can be treated with medicines till certain stage. You mean?
Heart failure, once you start with the medications, for example, I tell you, if you start with the patient is a diabetic and start with the medications, you have to continue lifelong. Same is with the heart failure. Once you start with, what happens after some time, we have seen the patients after 1 year or 2 years, the patient stops taking medications and then he lands again in the same problem with us. So once the medications for the heart failure is started, unless and until we don't find the reversible cause of the heart failure, as I said, maybe the postpartum cardiomyopathy, the myocarditis, these are the few examples where we can, or the drug induced. Sometimes the medications, some medicines you are taking from some other thing like the chemotherapy, the patients who have on the chemotherapy, or the patients on radiotherapy, they are the people who can have the heart failure symptoms, who can have the heart failure. And once their chemotherapy is stopped, you can just stop the medication. So these are the reversible causes. You can stop in that scenario. But in the cases where the reversible cause is not there, and this therapy is to be continued for a longer time. Till
In the meanwhile, I request viewers, you can please write down your questions in the comment box. So, uh, Dr. Suri, how can we take care of our heart besides being in love? As they say, love keeps heart young and healthy. That was on a lighter note.
yeah, yeah, I understand. So you see, the what I feel, the more human you remain in life, the more humane you remain in life. Not human, I'm telling you humane. The more positive you remain in your life, the more clear you remain in your life, and more focused you remain in your life. And whatever you do, you enjoy that work, whatever that work is. I feel that is enough to keep your heart healthy. That is from the emotional and the philosophical point of view. But from the medical point of view, we should try to control our numbers. We cannot control. There are some non-modifiable risk factors like age, like gender, like family history. We have no control on that. Whatever we do, whatever we try to force upon ourselves, we cannot stop our age. We cannot stop aging. So these are the non-modifiable risk factors. But what we can control or have a control over are upon the modified risk factors. And the more risk factors we are able to control, the more delay we are going to have with the onset of these risk factors, the better heart health we will have.
Thank you so much, Dr. Suri. We'll be taking questions from the viewers. We have a question, Hira Lal Kalu ji saying, how long it is advisable to do breathing exercise in the morning, followed by morning walk for 70 years plus?
See, if as I have already said, that if a person is starting for the first time at the age of 70, he should at least get the cardiac checkup done before and then start with the exercises. But if he is regularly doing that 30 to 45 minutes of walking per day for 5 days a week is what is recommended. And more importantly, at the age of 70, we should also take care of the other, apart from the cardiac health, we should take care of our the bones and the joints also. So I feel brisk walking for 30 minutes is good enough for the at the age of 70 if a person is regularly doing it.
We have
And
a question from yeah,
yeah, yeah, yeah.
please.
Go ahead. Go ahead.
Lukewarm water, empty stomach, is it really good for heart?
Yeah, no doubt about it. No doubt about it.
We have Okay, that's good.
Yeah.
We have a question from Balkrishna. What is third degree heart attack? I think we discussed it.
Third,
Third degree heart attack.
third degree heart attack. See, what actually when we talk when we talk about the heart attacks, we usually divide it into three stages: the angina, the unstable angina, and then the clear cut heart attacks, what we in a layman's language is. Angina is any chest pain, any breathlessness, any sweating that occurs on the exertion. That is angina. And if it gets relieved within 10 minutes, we call it stable angina. Anything that happens on the exertion, for example, I give you an example. A person is doing a morning walk, and it is his regular routine. And on one day, he finds that he is able to walk the same distance, but he is having the chest pain. He takes rest for some time, say for 10 minutes, and then he starts again. And he finds that it is fine. But he has developed that symptom which he was not developing, which he was not having previously, and it got relieved in 10 minutes after he stood, sat for 10 minutes on the bench. So that is what we call the stable angina. That is the stage 1. On the other hand, if the same person develops the chest pain while walking, and he sits on the bench and the pain does not get relieved within 20 minutes, it takes 20 minutes, more than 20 minutes to get relieved of that pain, we call it an unstable angina. So it becomes a stage 2. And the stage 3 is if the same person develops the chest pain, he develops sweating, and his chest pain is not getting relieved even after sitting for 30 minutes, and if the pain is persisting for more than 30 minutes, we call it that as a stage 3, or what we call the acute heart attack. So this is actually not this is what I could make out from what he is saying, the stage 3. These are not the medical, as you said, the medical language is very confusing, as is the medical terminology. So we don't have the stage 3 heart failure, this stage 3 heart attacks. We have this stage in the heart failure, but not in the heart attacks. But this is what I could make out what he wanted to get clarified of.
We
So
have a question from TK Boni.
any pain that lasts for more than 30 minutes should be taken seriously, and the pain which lasts for 10 to 20 minutes should be taken seriously next day, and then they can have the time to talk to the consultant, to the cardiologist or the family physician.
Thank you. We have a question from TK Boni. Doctor, kindly enlighten us about atrial fibrillation and what precautions one has to take besides taking medicines like blood thinners, Redoxa 110 extra, as advised by the cardiologist to one of my relatives.
Yeah. See, atrial fibrillation, as I said, the main function of the heart is to with which force it is pumping, and second is with which rate and rhythm. So when we talk about an atrial fibrillation, it is a problem with the rhythm of the heart. So what happens that there is a high command in the heart, what we call the sinus node, that gives the signal. That is the controlling point in the heart that gives the signal to the lower down AV node, that we have to pump the heart at the rate of 70 to 100. So when abnormality occurs, what happens, as we have seen in the societies also, we have, if on a lighter note, not I'm just correlating, just don't take it as a political thing, though I have an inclination towards writing those things. But on a lighter note, in if we see in our community also, we have lot of parties, we have lot of the leaders. So what is happening here, same is with the atrial fibrillation. So normal, in the normal heart, there is only single leader, as we have our Prime Minister, Mr. Modi. The SN node, what we call the SN node, that keeps the control over everything. But what unfortunately is happening in the atrial fibrillation case, the SN node loses the control, and there are small, small parties. They start dictating the terms to the whole heart. So they start becoming the leader. So one day, on Monday, Mr. X becomes the leader. On Tuesday, Mrs. Y becomes the leader. So then it becomes a chaos. So atrial fibrillation is more of what I call a chaotic rhythmic abnormality of the heart. So the issue is it can have it. The issue with the atrial fibrillation is that we don't. Uh, it is one of the problems with the heart that it can in, cause the increased formation of the clot within the heart, and that clot can dislodge into the brain and cause the stroke. That is the main problem what we have with the atrial fibrillation. So it can be the paroxysmal. Paroxysmal means that it comes and you give the medication, and within 24 hours it gets resolved and the sinus node takes over. It can be the permanent if it lasts for more time. Once it remains permanent, it becomes a problem. The long term anticoagulation is to be taken. But there are some about what we do, the radiofrequency ablations nowadays for these atrial fibrillation cases, the efficacy rate is only 30 to 40%. So what we do, we just put the catheter there, and then we start giving the current to the right atrium, to one of the chambers of the heart, so that the leaders are, we just cut their feet, so the leaders, they don't speak, the only one leader remains there. So that is what is the role of the radio frequency ablation, but the efficacy of that is only 30%. Until if the person is not comfortable with that, or he does not, because it involves the cost also. That is one thing. The second thing is the efficacy is only, even for doing the procedure, the efficacy is 30 to 40%. So if even after that, the 60-70% are there who will remain in the atrial fibrillation. In that scenario, the anticoagulation is to be taken lifelong. We have the newer anticoagulants nowadays, and they are much better than what we used to have previously. So one should continue with the rhythm control medication in that. Secondly, one should take the anticoagulations and take care of that the stroke should not happen.
Thank you. Sanjay Bhatt is asking, some of the times during emotional stress and anxiety, if you get pain in your heart, what should one do in that case?
Whose question is it?
Sanjay Bhatt. Sanjay.
What is what is his age?
Some I don't know. Might be in his
Okay.
40s.
Anyways, the emotional. There is a term what we call the Suksupi syndrome. So this is the syndrome usually seen in the young females or the elderly females who develop an emotional stress, and they are because of the release of the adrenaline, their the heart stops for some time, and there occurs a ballooning of the apex. So it becomes a dumbbell shaped heart. The left ventricle of one of the chambers of the heart, it becomes a dumbbell shaped, and what we call the stress induced cardiomyopathy, or what we call the Suksubo syndrome to this group of the patient, to people. This is a reversible condition. Once the emotional stress is over, the patient is going to recover. So I feel Sanjay should understand that once there is an emotional stress, one should do the meditations, take long breaths, and then think about, remain focused. That is what I said.
We have another question from Sachin Rai. Doctor, kindly clarify why the heart ailments are getting more often in young age nowadays, and what is the promising test to easily diagnose heart disease?
See, this is the problem what we already discussed, that we are the younger people. The younger people are getting the heart attacks nowadays. So one of the factors is what what we already discussed, is that we want to, the patience level of the patients of the youngsters is very less. We are seeing in our medical profession also the young colleagues coming, and they want to become the top shots in one day. So anything, any sort of thing, when you think beyond what you can do, that is going to create a problem, and that is what is happening to the youth right now. What they are doing, they think that they know everything, they want to do everything, but the capacity is not there. So once we start thinking about ourselves only, I just in the beginning also I said, we cannot go into the gym and think, yeah, I will, if Salman Khan is looking so nice at the age of 55, why I should not look at the age of 40? But he has been doing it since the age of 20. That is to be understood. So if you start the same thing doing at the age of 40, so you are fooling yourself. So once we start remaining ourselves, everybody is unique. We don't compare ourselves with the others, because everybody has his own way of understanding. So if we remain true to ourselves, I feel we will be finding less of the heart attacks. So when there is a disparity between what you do and what you want to do, that creates the stress in your body, in your mind, and that stress is one of the factors, especially in the young age, and with the involvement with the in addition to the that kind of a stress, when you start, doing the things which are not appropriate, like you go into a binge alcohol, binging of the alcohol you do, then you start taking you start taking those medications, the powders and other things. So these are the things which are involving our youth for the earlier cardiac involvement. The second thing which I feel is the child upbringing. As I said, the seed for atherosclerosis, for the clot formation, is starts forming at the age of 2 years. So once we are nowadays more of the nuclear families, we don't have time for our kids. Then what we do, we get the junk foods, keep them associated, give them the remote or give them the mobile phones and tell them to be with that and we do our work. So I feel we are promoting the sedentary lifestyle. We are promoting the childhood obesity. We are potentiating the increased incidence of the diabetes in the early ages. And these are all the risk factors. And once such kind of a generation comes in the forefront at the age of 30 or 40, what our elders used to suffer at the age of 70, they will start suffering at the age of 40. So I feel the child upbringing and more involvement of the grandparents. If the parents are busy, the more involvement of the grandparents and more involvement of the parents, whatever time they get for their kids, and make them physically active. Even if they are watching the TV, keep a cycle there and let them do it. And especially in the COVID times, the 2 years, the scenario has changed. The people have become more sedentary. The people have become more lethargic, less of the physical exercise, especially the kids, which they used to do in the schools. So all these parameters, we may have the one effect of the COVID, what we saw today, or what we are seeing today. But after 20 years, when this COVID will be over, we will be seeing the benefit, the drawbacks of this COVID era as well at that point of time as
We are also running short of time. I think we can answer precisely. We have
well.
a
Okay, okay.
question. Navneet Singh saying, if triglycerides are 230, is it dangerous and one should start medication immediately, or exercise and healthy diet can work in its reduction?
How,
Triglycerides 230.
how about the alcoholic status? How
He
about
has
the
not.
alcohol? Okay, so he is more focused upon the exercise and this thing, but he has not mentioned about the alcohol. And you will be surprised that if you talk about the triglycerides alone, the alcohol is the commonest cause of increased triglycerides. So I would have been happier if you would have mentioned his alcoholic status as well, so that I could have been clear in telling him that if he's
No,
taking an alcohol,
no, no. He's saying
then
no.
he
He doesn't
okay,
take alcohol.
then it is very fine. So the triglycerides, there was one of the few years back. The triglycerides were not considered as the risk factors for the cardiac ailments. They were only considered for the pancreatitis. If it is more than 500, then the chance of pancreatitis are high. But nowadays we see that this has a reverse association with the good cholesterol. So if you find the high triglycerides on the higher side and if you find the good cholesterol on the lower side, it is always better to take care of the triglycerides. And the best way of taking care of the triglycerides is that you avoid alcohol. If you are not taking it, then it is fine. And more importantly, do the exercise, start doing the exercises. And third is the timing of taking the sample. It should the sample once you're, because triglycerides, they fluctuate every hourly, every 2 hourly. So you have to be at least 9 to 12 hour fasting and then take this thing the sample for the triglycerides. But as definitely, if it is 180, I feel 150, up to 150 is okay. He is only 30 ahead of what is recommended. So I feel this much can be corrected with the exercises if he is not taking an alcohol and the diet.
One very important question we are coming up with. Some gym goers also take diuretic drugs for reducing the water retention. What is your advice to them as they are young people?
I
People take
told
diet.
that, yeah, I am telling you what they do. They give some medications first to increase the, in India, the problem is that what I have already discussed about, because the questions are such that you need a lengthy answer to these. So, anyways, that is not my problem. So, anyways, what I want to tell
We'll
here
have one
is
more
that
session.
okay. So, anyways, what they do actually, they give the medications first to increase their weight, and then they give the diet to decrease their weight. So it is all up to the gym people, and they do it just, and they purposefully do it. I don't I don't have anything against the gym people, but they purposefully do it because they want to run their this thing gym, and they want to show that yes, we can build your body, we can reduce your body. But the person who is undergoing the training, he should understand that any sort of medications, whether the diuretics, whether the steroids, whether the protein powders, whatever he is taking or whatever he is being advised to take, it is his own body. And I say categorically that nobody can exploit you unless you exploit yourself. So if you are not able to take decision for your own health, how can you take decision for anybody's health? So it is your own health. You know, you have everything available. You can take the consultation of your treating physician or the family physician or your friend who is a medical professional. He can tell you 10 things about that, whatever he is taking. So I feel the gym people should be discouraged from promoting such kind of things, and more responsibility. I most of the time say that it is not the person who dies, it is the person who kills himself. So I feel by doing such acts and by taking these things, he is killing himself just for the short term gain.
Thank you. We are getting a question from Anita Bhatt. My age is 43, female, and the abnormal heart rate remains from 5 minutes and can remain up to 2 hours. Please tell me what type of heart problem I'm dealing with. How can I cope up with what are the reasons and preventions?
See, if she is getting repeatedly like that sort of thing, then what what I can suggest is that she should get the Holter at least once done. Holter is a 24-hour machine and she can keep it there, and it will record the rate for 24 hours. And the way she is telling she is repeatedly getting it, I feel she is having more of a paroxysmal supraventricular tachycardia at the age of 43. So nothing to worry about it. Just but have one checkup of the cardiologist. Let get your ECG done, especially at the time when you're getting such kind of episodes, and this will make it clear. But as of now, the way you are telling that repeatedly it is happening and its age is 43, nothing to worry about. Just take one consultation.
I think we are done with the questions. We are not getting any more questions. I think
Thank
we
you.
should conclude the session.
Thank you. Thank you
Thank
very
you
much.
so much, Dr. Suri.
Thank you,
We are now
Bhavna. Thank you,
complete.
Rohit.
Thank you so much for taking out time from your busy schedule and providing us with the valuable information. Thank you
Thank you.
so much. We are
Thank you.
thankful to
Thank
all
you.
our viewers for watching the show. I would like to take your leave now. Take good care of your heart and health. Namaskar.
Thank you. Thank you.